Tawhafidid Zan Buenas tardes, Speaker Terlahi, and Senators. My name is Isabel Flores. I am a certified critical care nurse working in the adult ICU at GMH. I did not attend nursing school here. I went to nursing school in California, where I trained at a variety of hospitals in San Diego, to include Rady Children's Hospital. I started my nursing career at a magnet-designated hospital, and a magnet-designated hospital, for those of you that don't know, is a medical facility considered to be the gold standard for nursing practice and innovation. As we are all aware, GMH is not a magnet-designated hospital, and it is very far from it. I'm here today to share that despite what the administration has previously said, the state of the hospital is far from good, and we did not handle the typhoon well. During the storm, there was widespread flooding, stairwells and elevators turned into waterfalls, ceilings and walls caved in, loose shutters banged on the windows for hours. There were multiple electrical fires in the mother and baby unit, and now it smells so musty throughout the facility. I was at GMH for 72 hours straight during the storm, sleeping on cots in the hallways with my fellow colleagues. And I know every single one of them would agree with me when I say that that building will not withstand another typhoon. It's common knowledge that water and electricity do not mix well. And that was made obvious when we had to evacuate the OB ward because there was so much smoke coming from the outlets due to electrical fires. There was also a very big electrical fire in the cafeteria. During the storm, an unfamiliar overhead page was announced. Any available staff report to the generator room immediately. The lift gate in the generator room almost blew in. The heroes of the night, and I want to emphasize that they were true heroes, were the facilities maintenance men who literally held the building together with their own hands and 2x4s. Do you know how disastrous it would have been if the generator room flooded and blew in? We do not have enough staff to manually bag every ventilated patient for days. And our most recent event that happened was a snake was found in the ceiling of our infection control office. Snakes do not belong in hospitals. That's just unacceptable. And what I'm really struggling to understand is that during the COVID-19 pandemic, GMH received millions of dollars in federal funding. Yet why is it that we are worse off than we ever were before? And those are not even my words. Those are the words of a colleague who has been at GMH for over 30 years. So she has a little more perspective than I do. We regularly lack essential materials like linens and pillows, diabetic tube feeding formula, underpads for patients to poo and pee on, inner tracheostomy cannulas, wipes to clean patients, pre-filled epinephrine syringes for medical emergencies, and there's so many other things that I can add to this list. Where did all this COVID money go? As healthcare providers, we are being asked to provide care without being given the tools needed to practice that care safely and, frankly, up to the normal standards of care today. The policies that were made for GMH are extremely outdated. I'm here to testify, to plead with you that we rethink how we appoint the leadership of this agency. Our hospital administrators and board of trustees cannot be politically appointed positions, because a politically appointed person's loyalty aligns with their political party. It does not lie with patient care and safety and the overall well-being of the hospital. I know this is the way it has been for years, but where has that gotten us? A dilapidated building rampant with mold, with snakes living in the ceilings. The superintendent of the Guam Department of Education is hired by the Guam Education Board. Guam Power Authority has a public-private partnership with TEMIS to maintain the power plants. The government of Guam has not been able to maintain the public pools. What more a hospital agency? GMH needs systemic change because the existing systems are not working. We need administrators who are hired based on their qualifications and who are credentialed to run a hospital organization. Administrators whose priorities are patient safety and most especially financial literacy, catering to an indigent population, because that is the population that we serve. There was talk of getting the hospital out of government procurement, and that would be so great. We need supplies at a much faster pace than government procurement allows for, except someone put a halt on that. There are only a few reasons I can think of why someone would not want GMH to do their own procurement. And that is, one, they just simply do not understand how important doing their own procurement is. And two, they probably know someone who has a government bid that supplies the hospital and they don't want to cut ties with that person. We didn't have wipes for months. As an alternative, we were told to use paper towels to clean and bathe our patients. To our embarrassment, patients' families witnessed this and have donated wipes because of the pitiful situation the hospital is in. It's sad and it's embarrassing and it's disgraceful that you have allowed this to be the standard of care for our patients, for our people of Guam. We often don't have pillows for our patients or clean linens and gowns. Imagine yourself in that bed, or your mother or your child, laying in their soiled personal clothes, soiled sheets, with a rolled up blanket under their head for a pillow. The second chiller went down after the typhoon and it was hot in the hospital. The solution to this is standing fans and portable AC units in various parts of the hospital, and thankfully things are much cooler. But I really wonder how much all these portable air conditioners cost. How much was spent on the fans? Where will they store all of these? Because after COVID settled, they stored all the portable vents in the viewing room, and the viewing room was unavailable for families for months. And only when we had pushed for the viewing room to be reopened after many, many frustrating experiences with dying patients and their limited family members at the bedside because of restricted visitation, did they finally work on reopening the viewing room. Several months ago, there was a big push on waxing the floors. And it's comical to me that of all the things that need fixing in the hospital, waxing the floors was such a priority. And I wonder how much that project cost. Our copy machine was down for weeks in our unit because we haven't paid the Xerox vendor. So no faxing important documents, had to borrow other fax machines from different units. Maybe those waxing funds should have been used to pay Xerox. There's been a recent hold on new employee access to our electronic health record due to the $234,000 we owe to CareView and MedSphere. So incoming nurses have been told to share their access with another nurse, which may compromise the license of that nurse sharing their access. All this to say that the disconnect between the people making the decisions and those that have to work with those decisions on a daily basis is so unreal. Speaking of disconnected decisions, the most prime example I can think of was the recent shutdown of our entire hospital network, including the phone system. A memo went out for the hospital-wide system maintenance for an estimated 48 hours, as stated in the memo sent to our employees. This official communication to the employees was fraudulent. The shutdown was not for system maintenance, but a suspected breach in our network system. The decision to shut down was made by a select few administrators and the legal team, with no communication to the medical staff for over a week to share the actual truth about the situation. And the saddest part is that the after-action report indicated that there was no breach of protected health information, meaning the shutdown was completely unwarranted. The 48-hour network shutdown turned into 5+ weeks in which we were forced to go into complete manual mode. Staff were utilizing their personal cell phones to communicate with different departments in the hospital, to communicate with families. All documentation was handwritten, including urgent lab and radiology reports that had to be physically walked over to each respected department. The situation left us without the crucial established safety checks, and patient safety during this time was solely dependent on the diligence of the nurse and the ancillary staff. There was so much room for human error. Billing was also greatly affected due to the inability to electronically capture hospital charges. The scope of financial and potential patient harm due to the poor decision-making of these select administrators and the legal team is still not fully known, and honestly won't ever be known because there's no way to track it. One of my biggest reasons for being here today is that this past year I witnessed a beautiful child die. And I will never, ever forget that experience. And what happened after this death? Nothing. No debrief on the situation, no evaluation of our pediatric ward, no grants written to improve our pediatric unit, no mandatory training to sharpen our nurses' knowledge and skills. As a matter of fact, we've gotten pushback as to why our nurses need more training from our own administration. GMH is the only public facility in over 1,000 miles that can treat children in an acute care setting. GMH is our children's hospital. If that doesn't make each and every one of you want to jump out of your seats and build the hospital yourself, then you really shouldn't be sitting in those seats. God forbid that a child that you know and love has to be hospitalized, and then you will really see the conditions and the limited resources that GMH is working with. I can tell you all of the things that we go through on a daily basis, but frankly, I don't think any of you really care, because if you did, there would be some change. If you're not sitting in those seats to actively advance the lives of the people here, to make Guam a better place, then you shouldn't be in those chairs. Eagles Field was shut down. Okay, what's next? We haven't heard any word on that. We need a new public hospital. As senators, it is literally your obligation to figure out a plan for a new hospital. And for those of you that have been in office for 5, 10 years or more, who have failed to prioritize progress and improvement in our healthcare system, your complacency has really cost many lives, and that blood is on your hands. And I'm not sitting here complaining for my own benefit. I'm here because I'm the one taking care of the people in those beds, and I want better for them. But I'm wasting my breath sitting here and asking what the plan is, because I know none of you actually have a plan. Because if there were a plan, there would be some action. Not just words, because words mean nothing without action that follows. I'm here to tell you what we need, and that is first and foremost a new hospital building, if not for anyone but for our children. And secondly, a new hospital building that is led by qualified administrators who are hired based on their ability and training to run a hospital organization. GMH must be depoliticized, and anyone who is against this idea is against the health and well-being of our people, and they are against improving our island. Thank you.